If your child has an autism diagnosis, chances are the very first therapy recommended to you was applied behavioral analysis, or ABA. Why? Because it's the most researched. It's the one therapy that most insurances will actually pay for, and it comes with data charts and graphs that make it feel official and scientific. But here's the question that I want to explore today, not with fear or guilt, but with clarity. Is ABA truly the best option for your child, or is it just the most validated? In this video, I'm going to walk you through why ABA is so widely recommended. We'll talk about the controversy, because there is controversy, and what autistic individuals and their families have said to me about their experiences, which might surprise you. I'll give you my opinion of ABA, and I will give you my 2 non-negotiables that I talk about with parents before I ever support a family working with ABA. And by the end of this video, you will have my antecedent checklist, the one that I use in my own clinical practice to identify what really is behind the behavior. Hi, I'm Dr. Dana Johnson, occupational therapist with a PhD in child mental health and development and advanced training in functional and nutritional medicine. Early in my career, I worked in an ABA clinic for a couple of years. I learned a lot, and that experience absolutely shaped how I support my families today. So this video is not about parent shame. If you chose ABA or you're currently in it, hear me very clearly. You made the best option you could with the resources that you had. This conversation is about giving you a clearer lens than the one that you had before today, so you can advocate and make the best decision for your child with confidence. So why did ABA become the default option? Well, number 1, insurance approves ABA. Now, most therapies for autism are difficult to get covered. ABA, it's generally covered, although that is changing on a regular basis. It's typically approved for 20 to 40 hours a week, and that gets families started, and getting them started gives them hope. Number 2, it is the most researched model to date. Now, healthcare systems require research-based interventions. I had to always make sure that I could back up my therapies with evidence-based practice, and ABA has pages and pages of data collection built right into it. That makes it easy to measure and publish studies. Now, if you're providing more of an individualized therapy like I do, research is much more challenging. Now, number 3, it produces measurable outcomes. ABA is designed around behavior change and reporting. For example, tantrums decreased by 30%, or task compliance improved 4 out of 5 opportunities. And numbers look good on paper, and we see clear progress. Everyone wants to see progress, but is it really progress, or is it something else? So with all this, it makes sense that ABA became the automatic recommendation by pediatricians, psychologists, and neurologists, all who diagnosed autism. Here is where the controversy comes in. Many autistic adults who went through ABA have spoken publicly about feeling controlled, dismissed, and trained to appear compliant rather than feel understood. Some of my clients talk about emotional trauma that they were still dealing with as a result of years of ABA. Other families shared that ABA was helpful for teaching specific skills like dressing or toileting, and I can understand why. Those therapies involve a lot of repetition, and repetition does support progress with motor planning and motor learning. However, the improvement isn't necessarily happening because therapists understand whole body apraxia. It's happening because they believe these individuals need high levels of repetition to learn, rather than recognizing that the real issue is motor planning and not their capability. Finally, and most importantly, ABA does not account for whole body apraxia, which is a motor planning and initiation challenge that most non-speaking or minimally speaking autistic individuals have. So what does that mean in practice? Well, a child who physically cannot initiate movement is often labeled as non-compliant, defiant, or not trying, because that's what it looks like on the outside. But in reality, their body just can't get there. They just can't move. Now, if you've tuned into this channel for a while, you'll know that breaking down a task and then supporting the individual with motor coaching is the key to building intentional and purposeful movement. Now, check out my video on motor coaching that I will link in the description, and you can see the thumbnail here. Now, ABA therapists are really good at task analysis, which is breaking down the skills into steps, and that's very aligned with motor learning. But here are the critical missing pieces. ABA tells the child what to do, but does not use motor coaching to support the body on how to do it. And that's a motor issue, not a behavioral one, meaning that if the child doesn't follow through to complete the task, it's not because they don't understand or they don't want to. It's because they can't initiate their body because they have whole body apraxia. Now, the goal of ABA is often to reduce these visible behaviors, especially the ones that are socially inappropriate, instead of asking, why is this happening in the body? And sensory needs like movement, proprioceptive input, vestibular input like swinging are often treated as rewards rather than regulation tools that the child's body actually needs. Now, don't get me wrong, there are absolutely ABA therapists out there who care deeply, who are open to learning, and who want to collaborate. But I want to talk about my two non-negotiables. Non-negotiable number one, the entire clinic, ABA center, must understand whole body apraxia. And not just in theory, but specific to your child, because apraxia is consistently inconsistent, meaning that what your child does once may not happen consistently, or that they can't initiate their body on demand. And if your team doesn't understand this, they will collect false data and mislabel their motor struggles as behavior. Non-negotiable number two, they must actively presume competence. This is more than just saying, we believe in your child. This means speaking to them at age level, offering communication access that gives them reliable communication, and assuming that they're understanding even if they can't demonstrate it yet. If those two foundations are missing, then ABA turns into performance training instead of supported development. And for me, your child's dignity, nervous system regulation, and long-term mental health are not optional. They are the foundation to progress. So is ABA the only option? Absolutely not. I've worked with many families whose children have complex autism and have never done ABA. Their teams include biomedical support to address gut, immune system, sleep, diet, and even inflammation. They include an OT who understands whole body apraxia, motor planning, reflex integration, vision, and functional movement. And they include speech therapists using a reliable form of AAC for that individual, like spelling or typing, not just typical speech-related therapy. And finally, nervous system regulation has to be a core foundation and not just an afterthought. Okay, so here is my antecedent checklist. I call this my antecedent checklist because in ABA, the therapist will use the ABC model to understand and analyze the function of the behaviors that they're trying to modify. And the A stands for antecedent. Now, when a child is dysregulated, refusing tasks, or shutting down, here's what I ask myself before labeling anything as a behavior. How is their gut health? Is it inflamed? Are they constipated? Do they have reflux or food sensitivities? What is their diet like? Is it high in processed foods or high in sugar? What about their sleep? Are they getting regular sleep? Are they getting enough sleep? Is the nervous system in fight or flight most of the time? Is there sensory overload in a specific environment? Is the lighting too much? The noise, the visual input? Is there a lot of chaos? And this is so important. Does the child have a reliable way to communicate? Because here's the thing. If you are exhausted, in pain, and overstimulated, and someone said, point to the red square or touch the cow, and only rewarded you when you got it right, that would absolutely not regulate your system or build trust. So I use this checklist to get to the root cause of the behavior or the dysregulation that I'm seeing in my client. Now, the majority of ABA programs struggle to fully presume competence and adjust for whole body apraxia because that model was not built on those those as core assumptions. So do I recommend ABA? If ABA evolved to deeply honor autonomy, motor challenges, and communication access, then yes. But if this happened, the truth is ABA would not exist as we know it. If you're currently in ABA or considering it, the goal of this video is for you to feel equipped, not overwhelmed. And if you want to go deeper into whole body apraxia, what it looks like, how it's misunderstood, and how to support your child with it, make sure you're subscribed because I drop videos here each week. And also, please comment and tell me about your experiences with ABA because we need to build a community of supported parents and professionals so that we can know better and do better. Thank you, and I will see you on the next video.